different rendering modes that we use in 4D.
Okay.
This is called as a surface rendering. Surface rendering is basically to see the surface features.
Okay.
And the skeletal features, suppose the ribs and spine has to be evaluated, we go for the maximum intensity projection.
Okay.
It is seen here. So this is a 4-dimensional image of a baby in of 11 to 12 week size. This is called as a minimum mode. Suppose a fluid filled structure is there in the body, like a stomach. For example, the baby's stomach will be filled with fluid.
Okay.
We will be able to see those fluid filled structures in a different format using this minimum mode. You can highlight those structures, and if there is any abnormality related to those structures, so these are the great arteries coming from the heart, called as aorta.
Right.
And this is called as the IVC, that inferior vena cava. So all these great vessels can be seen very clearly.
Okay.
This baby had a congenital abnormality related to the urinary tract. That means the bladder was overly distended, and there is something called a posterior urethral valve.
Okay.
Because of that, the urine was not going out.
Okay.
So because of the back pressure, the urine was going back into the kidneys, and this is how it looks.
Okay.
The kidneys are dilated and filled with urine, both the kidneys. The bladder is also distended.
Okay.
And you can easily make out this obstruction at the level of the bladder, at the level of the urethra.
Okay.
So this can be seen and shown to the doctors as well as to the parents that here at this level we have got an obstruction, and this has to be cleared after birth.
Okay.
An early detection of such a condition helps the parents as well as the doctor who is going to treat to plan things accordingly, even the delivery and immediately the period immediately after delivery also can be taken care of.
Correct.
This is the 4D probe. This is a different technology that uses a different probe, and this is how the 4D probe looks. It's a thick probe which has got different sensors as well as crystals, and with a single sweep you will be able to get a 3-dimensional image.
Okay.
This is another advantage of a 4-dimensional scan, that you will be able to see the different sections just as you see it in a CT scan or MRI scan.
Okay.
You can see the different slices of a particular area of interest. This is a baby's head, and the brain is being shown here.
Okay.
And we can see the internal structures very clearly at say for example 0.5 millimeter thickness. You can evaluate those structures.
This is also called the tomographic.
It's also called as the tomographic ultrasound imaging, or otherwise called as multi-slice ultrasound.
Okay.
So basically what I said, it makes an evaluation much more easier because it provides more information.
Okay, got it.
This is again use of 4D ultrasound in evaluation of heart. You can see the heart in different levels.
Okay.
And can evaluate the internal anatomy of the heart and the blood flow within the heart. Is there any valvular problem? Is there any hole in the heart?
Okay.
All this can be evaluated with this technology, much better than the 2-dimensional image.
Okay.
This is to evaluate the skull and the sutures, and if there is any abnormality related to the bone, it also can be made out.
Okay.
This is again internal structures of the brain. Evaluating these structures is possible only with 4D, not with the 2D. Suppose an organ like corpus callosum, if there is that is actually the connecting part between the two hemispheres. We have got two hemispheres.
Brain, yeah, okay.
So that connecting part, if that is absent, the baby will be having severe mental retardation and all problems like that. So just to see the corpus callosum, 4D gives an excellent technology, and 4D gives you an excellent plane like this and just shows the corpus callosum there.
Okay.
Then one more aspect that I would like to discuss on the use of 4D technology in pregnancy is something that I've observed. When seeing a baby's face like this, and especially you can see a lot of fetal emotions. This is one example where you can see the baby smiling, and when the mothers see their baby's emotions in either the smiling or the first thing they take advantage of or they get to know is the face. Till that time, till 4D, They did not know, they did not have a structure, they did not have a concept about the baby. Now they've got a face to relate to.
Okay.
And especially seeing emotions like this increases a better feto-maternal bonding. There will be a much more better relationship between the mother and the baby. Especially in ladies who are pregnant for the first time, they've got a lot of anxiety related to pregnancy. And once they see the baby's face like this, they are better reassured that they can relate to their baby in a much better way. There is a much better feto-maternal bonding. So this may be called as the fifth dimension. That means the emotional aspect that can be added to the 4D scan.
So, Dr. Rijo, would the baby actually come to know that he or she is being watched by her mother during a 4D scan?
Yeah, that's an interesting question. See, when we do the 4D scan, of course, there is a little bit of mechanical pressure from the probe side. We have done a series of cases, a series of studies, especially to assess the feto-maternal bonding. There were a lot of mothers who used to tell me that they used to talk to their baby, and when they talk, they can identify and their response, their activity is more. So we thought of checking it with 4D, and in 90% of cases, what these mothers said were true. When we started the scan, the babies were absolutely quiet, and as we started seeing the fetal face or fetal body parts, and the mother also started watching it, she started talking to the baby. All of a sudden, the activity was more.
Okay.
So right at this point of time, I'm not in a position to explain what sort of communication is taking place between the mother and the baby. Okay. Of course, that's why I mentioned that there could be a fifth dimension of thoughts or emotions or whatever it is, and better communication between the mother and the baby. So we've done a series of studies on that, and 90% of them, what the mother said was absolutely true.
And you were saying about the uterus abnormalities at 4D scan.
So apart from pregnancy, where 4D ultrasound can be of major use is in the evaluation of the uterus especially in cases of infertility. There can be certain congenital anomalies in the uterus where the uterine cavity can be split by a septa, or there can be two different cavities. All these things can be very clearly shown on 4D scan because we can see the structure in different planes, especially the coronal plane which I mentioned earlier, which is not possible to see with the two-dimensional ultrasound. With the coronal plane imaging of 4D, it is possible to see the uterine cavity, and if there is any congenital anomaly or any structure that is there within that uterine cavity obstructing the possible growth of a baby, like a fibroid or a polyp, we will be able to clearly make out that structure. So that helps in the evaluation of infertility, especially the female infertility.
So in short, you're saying that a 4D can also help a woman to know whether she can be pregnant or not before conceiving.
Is there any abnormality related to her uterus and ovary? Okay. And another application of 4D in women's imaging is in the 4D in breast ultrasound. Okay. Especially in breast ultrasound, since we can see the structure in three different planes, if there is any lump that has been detected, there is a question whether this is a innocent one or a cancerous one. Okay. So in 4D, it is possible to see the margins of that particular lump, and if it is irregular, especially its retractile, there is a particular sign called as retractile sign in the coronal plane of 4D, which in our series and in the series of most of the practitioners, 99% turns out to be cancerous. Okay. So 4D gives an additional information there. Okay. And of course, the tissue diagnosis is important. You need to get a biopsy to prove your case.
All right, doctor, that's all. Thank you for being on our show.
Thank you. Thank you.
Well, that was all about 4D scan and its various advantages of having one done. Thank you for watching.